Dr. L. Johnson, we can talk about that, Doc. Good morning. How are you?
Good morning.
I'm sure that's a topic we could talk about, but in this case, we have you on when it comes to the flu vaccine. And Andrew, before we go anywhere, tell him your theory. You won't ever get you're never going to take the vaccine.
I'm never going to get the vaccine again because the last time I had one, it was when the swine flu was going around and I caught it.
Okay.
You caught the flu?
I caught the swine flu.
He knows for a fact it was swine.
That's what they told me.
Oh, they did. What do you think?
Well, that can happen in the sense it depends on what the strains are actually in the vaccine. The first time the swine flu went around, that strain was not in the vaccine, so you wouldn't expect it to protect you.
And doctor, would that weaken? So let me ask you this: if I were to get the flu vaccine with a different strain, and then would that make me then more susceptible to strains like the swine flu?
No. In fact, there's a non-specific effect that occurs when you get a vaccine that kind of stimulates your immune system in general, plus towards those specific strains that are there. So there is a benefit to it, as long as you aren't allergic to egg or have an allergic reaction actually to the vaccine.
So, but you do hear this a lot, right? People say, I would not get that. I don't get immunizations. I don't get any of this stuff because you can get really sick from it, which I guess in rare cases that could be true, right?
Yes. What happens is that it stimulates your immune system and you create an immune response, which is similar to getting the flu. But you really don't have the flu, but it's flu-like because of your immune response to the vaccine.
Yeah. Tell me, they say that this flu shot this year doesn't cover some of the more severe strains. Should we still get it?
I think it makes sense in that you're getting protected against those other common strains which were projected to be there. So there is some protection from that, and it does stimulate your immune system, as we talked about earlier.
Yeah.
Now, the flu vaccine tends to wear off after a couple months. So if we get a resurgence of the virus, then a second vaccine may be indicated in some situations.
Got it. Okay. So if I haven't gotten it yet, would it be beneficial for me to get it now?
Yes.
Yeah.
Sure
Okay.
could.
All right. And what about some of the stuff? You see a lot of flu stuff, over-the-counter stuff you can spray that supposedly will handle the airborne germs that are making their way into your nostrils. I mean, does any of this stuff work?
Well, it does have some benefit. The best thing is to really practice hand washing and be aware of those people that are around you. And if you have the flu, don't go out and expose other people to it. So, common sense and hand washing is still the best thing.
And what about, it almost seems like there's beginning to be a bit of a change. It used to be that if you're sick, I know in radio, if you're sick, I don't care what you have, bring a pail along if you're going to need to vomit or something, but you make it to work. It seems like there's been a change in that regard where employers are thinking this out a little differently today.
Well, yes, and they should, in the sense that if you're sick and you bring the flu to work and you cause other people to get the flu, then you really do have a problem in the sense that you have less personnel there and more personnel sick. So it makes sense to stay home, get well, don't spread it around. Wear a mask if you're sick and have to be out, so you aren't coughing and sneezing on other people and other things that can spread it.
Yeah, I find myself diving from, I'm walking down an aisle at the grocery store and somebody sneezes. I turn around. I go the other way. I want to be as clear of that as I possibly can be.
Exactly.
Yeah. One last thing. We were talking about immunizations. Yes, it's true in rare cases, by the numbers, bad things can happen to people who get immunized for whatever, measles, mumps, whatever it is, polio. But these vaccinations have really virtually eradicated some of these serious diseases certainly from the United States, right?
Well, yes, and you're talking about other types of vaccines.
Yes, yeah, yep.
Yeah, what a big proponent of is getting only one vaccine at a time, so you don't overload your immune system. Because if you get more than that, it does stimulate the immune system. It can overload it and cause adverse problems. And so whether it's children that are getting vaccinated or adults, I suggest that just get one at a time, because there's not a really good way to tell in medicine how a person is going to respond to it.
Yeah.
Now, we do know those that are immune compromised or do not have fully developed immune systems can have more adverse reactions.
Last quick one here. Do you like the shingles vaccination?
Yes, it works, and I'd suggest people get the shingles vaccine.
Okay.
Because having the shingles is no picnic at all.
Yeah.
And there are a lot of ads right now on TV for HPV for teenagers, for young teenagers. What about that?
I think, and this is my personal opinion, is I think we really need to look further at that. There's a whole bunch of HPV viruses out there. I think there's only 3 in the vaccine. I'm not sure exactly what the outcome's going to show in the future. So I think an individual really needs to look into what they're trying to prevent, whether it's necessary, and really look into the adverse reactions with the vaccine.
All right. One final call from a listener, question from a listener.
Yeah, Pneumovax, the Pneumovax vaccine for seniors.
Yeah.
Is that good?
No, that makes sense. Also, and again, get it when you're healthy, one vaccine at a time, and it does help boost your resistance against the pneumonia. So, if you're in that category that makes sense for increased risk, then it's a good vaccine.
Dr. Al Johnson, we could go on for hours. I really appreciate your time. Thanks so much.
My pleasure.